surgical center. I am 100% satisfied, happy, excited about my choice. If I had to go back and do it again, I would do it again in a heartbeat. I've always felt like I had a bright future, but now it feels even brighter because I don't have the anxiety of battling weight. Yeah, it's been hard work, but I am definitely proud of myself. And I'm really excited for everyone to see my final goal. See where I end up, what I look like, what I'm feeling like, how I'm doing, how I'm living my life.
Welcome back once again. You're still tuned to the Saudi Morning Show, and well, joining us here in the studio is our very esteemed guest, Dr. Azzam Al-Qadi, who is a consultant bariatric surgeon, and we're going to be speaking to him more upon the lines of obesity, especially morbid obesity. Assalamu alaikum and good morning, Dr. Azzam.
Thank you very much for inviting me to the show.
It's our pleasure to have you here, Dr. Azzam, and currently we get to see so many fast food joints opening up here in Saudi Arabia. We get to see people, as they're living sedentary lifestyles, they're eating more, exercising less, becoming couch potatoes with internet and social networking websites that they are logging on to these days. And at the same time, we get to see that people are not willing to do much changes to their life, but at the same time, they do not want morbid obesity. When we talk about obesity, especially in Saudi Arabia, tell us, how do you see it? And at the same time, if you can, for our viewers, mention roughly as to what are the statistics or rough rates of obesity in the kingdom.
Okay, thank you. Well, the numbers are shocking, actually. Saudi Arabia, just like the rest of the world, we are facing a major health issue that is called obesity. 2 decades, obesity was not a big issue, nor in Saudi, neither in other areas of the world. Nowadays, we have an obesity that is growing fast. The numbers are doubling because of so many causes that we will discuss. We don't have an actual accurate numbers of obesity in Saudi Arabia. Yes, we do have reports on the incidence and prevalence of obesity in Saudi Arabia. One study was done in 2005 that showed the numbers to be around 40% of population in Saudi Arabia.
40%?
Yeah, that's a big number, actually. What's actually more scary is the recent data that came up 2 years ago that shows that 60% of population in Saudi Arabia are diseased with the abnormal weight. So either it is an overweight or obese people.
Indeed, and it's really sad as well, Dr. Azzam, because we get to see about 60% of the Saudi population is still below the age of 30.
Yes, absolutely, and this is actually a good point, because obesity in children is actually growing up. The numbers are really now, we're talking about 20% of children are faced with obesity, and what's actually sad is that 80% of the obese children, they become obese adults. So we know by fact that if you are obese when you are a child, then the chances that you will be a fat when you are or obese when you become an adult is high.
Indeed. And Dr. Azzam, it seems that the problem is right now present. Where does it seem that we went wrong regarding the obesity? It seems that it's been more, every year it's been, the issue's been more complicated, higher percentage. Where did we seem to have gone wrong?
Yeah, I think the reason and the causes for what we see actually in terms of growing number is actually number one, the causes are many, but the most common ones are actually I would say unhealthy diet habits. We tend to eat more junk food, high calorie food. We have a busy life, so we don't have a lot of time to spend for eating healthy food. We take an easy food that tastes really good, but it has very high calories. At the same time, we don't exercise enough, so we can burn this amount of high calories that we ingest every day. So these calories will be stored in the body as a fat.
Indeed, so our input is more than our output, and
Exactly.
this is basically the reason for people to be putting on weight. Nowadays, especially Dr. Azzam, we get to see that everybody wants things easy in life.
Yes.
That means that if somebody has spent 2 years or maybe 20 years, 2 years if not 20 years, in putting on all that weight and leading themselves to obesity, then they don't really even want to work 2 months or, you know, about 6 months on getting rid of that weight. They want like a quick solution for it. So when we talk about quick solutions, nowadays we get to see so many of the people resorting to different kinds of surgeries, weight loss surgeries. Tell us a little bit about the different treatment modalities for obesity, because we are looking for a shortcut today.
Sure, yeah. Everybody looks for the shortcut. Well, the treatment of obesity is just like any other diseases. Most of the time we have two main lines of treatment. Either it's a surgical or non-surgical. The non-surgical, most of people know the details of the non-surgical treatment. So we're talking about changing your diet habits, eat less calories, focus on healthy food, do exercises minimum of 30 minutes per day.
That seems to be the route that people avoid.
Yeah, exactly, which is the hardest on people.
Yes.
And then we move on to the next level of, for example, using some medications that can help you to lose some weight, or using some gastric balloons that can help patients to lose some weight as well. There are so many types of gastric balloons that we will discuss.
Indeed. But Dr. Azzam, let's say if we specify one by one, what are the different types of surgeries? Like we have heard about stapling,
Yes.
As well as gastric bypass,
Yes.
the balloon one as well. Tell us a little about them.
Sure. So the most common surgeries that we use to treat morbid obesity is basically gastric banding, where we place a band at the top of the stomach. It works like a valve, so it doesn't allow patients to eat more than a small amount of food. The second most, the other most common surgeries are the sleeve gastrectomy or gastric stapling surgery, where we remove 80% of the stomach. And so the patient is left with a small stomach. That's basically the mechanism of this surgery. The third common type is what we call gastric bypass or Roux-en-Y gastric bypass. In this procedure, we make the stomach smaller, and we make the length of the bowel shorter, so the absorption of food is actually minimized with this surgery.
And which procedure is the safest one?
We don't use the term safest in surgery because we believe all of them are safe in general. Otherwise, we will never offer them to any patients. We use terms like complication rates, morbidity on patients, and in general, they are similar in terms of the number of complications. Some of them have specific complications than the other. There are types of surgery that is more appropriate for certain people than other types. For example, if you're diabetic and obese, then Roux-en-Y gastric bypass is probably #1 option because it can treat actually your diabetes as well as your obesity. So it depends on the general health of patients, other factors like previous surgeries, if the patient has any other diseases, if the patient takes any other medications, and then so this might be a good for this patient, the other one might be #1 for this patient.
So it would be customized according to the patient.
Yes.
Now, but as we're looking really for a shortcut, and as well as Dr. Azzam, when we talk about any of these surgeries, these are proper medical surgeries which need to be conducted in operating rooms.
Absolutely.
That means anesthesia.
Yes.
Lots of the people who are not afraid of surgeries are afraid of anesthesia.
Yes.
Hearing sometimes sad stories of people never waking up after having anesthesia, though we know that things like that do not happen anymore, yes. But nonetheless, we get to see that some of the people have their own fears. Now, is there something a little more simpler, a little bit more inexpensive in comparison to the rest of them?
Yes, there are actually easier options for people who want, I'm not going to say a shortcut, but less invasive options than surgery. For example, gastric balloon is one of the modalities that we use for patients to treat their extra weight. We have to be careful when we say balloons because we don't use it for morbid obesity. We use it for people who have overweight or class 1 obesity mainly. so it can help them to lose some weight. And then the types of balloons are different. Now we have a new one that is called OBALON.
Yes, that was going to be my next question about what is an OBALON balloon and how does it work?
Okay, well, I brought a sample to the studio. This
Great.
is the first time for me to bring a sample to the studio. It's a very new technology of a balloon. Normally we use endoscopy to put the gastric balloon, and the function of the balloon basically are two. So it occupies a space in the stomach, so you eat this. And then the other thing is actually stimulate your satiety receptors in the stomach. So you always feel full. You don't feel hungry. So the same thing for this balloon, which is new as well. But the insertion of this is different than the usual balloon where we use endoscopy. This is just like a pill. So it is very easy. The patient will come to the clinic, and then we give the pill to the patient with a cup of water. Under radiology or x-ray, we can actually ask the patient to swallow it, which is like swallowing a vitamin pill. And then watch the capsule. Mm-hmm. The balloon is inside the capsule. Watch it as it goes down through the esophagus into the stomach. Mm-hmm. And we use a special system that tells us about the pressure, so we know when it is inside the stomach, beside the radiology, the x-ray.
And
we would request our director, Mr. Saghayr Al-Shahri and Mohammed, to show the pill that Dr. Azzam is having in his hand, as this seems to be really a quick and easy way of trying to suppress your hunger, suppress your appetite, and maybe for good even. So we're going to find out more about it, but for the moment I want our camera to zoom in on this magic capsule that Dr. Azzam is having in his hand.
And Dr. Azzam, at what weight do you use this procedure? Is there a specific weight where they become too big, or is like they have to wait to a certain limit? Can you please elaborate on that?
That's a very good question, actually. We don't rely on weight only when we classify the obesity. We use something called the body mass index.
Okay.
And this is more accurate to really know what is going on in terms of how much fat, how is the weight for the patient. Mm-hmm. And so the normal number is between 18 to 24. Anything above 24, that's abnormal. Up till 30, this is called overweight, and then more than 30, this is obesity.
Indeed. Dr. Azzam, if you can show it to the camera,
yes.
which is right in front of you.
So here it is, the capsule.
More clearly.
And the balloon is actually folded inside the capsule.
If you hang it in your hand from the bottom, it would be more visible to the viewers.
And Dr. Azzam, the treatment, how long is it, and is it removable? Because I don't want people to think they swallow it and it's gone, like a disappearing act of a coin.
I wonder if the camera can see it now clearly.
But for the viewers at home, it's like a small capsule, it's like the size of, say, a multivitamin pill.
Yes.
One of the little large ones, and at the end there's like smaller strings of it. Please elaborate for
Yes.
the viewers.
So the capsule is actually attached to the small tube.
Yes.
When the capsule gets inside the stomach, the outer shelf dissolves,
Yes.
and then the balloon opens.
Yeah.
And then the tube, we use it to inflate the balloon while it's inside the stomach. Okay. We can actually see it by x-ray. So the balloon can get up to 250 ml cc, the size of the balloon. And once we are happy that the balloon has expanded completely, we inject water through this.
Okay.
And then detach the tube from the capsule and just pull it very smoothly from the mouth of the patient.
Right. But let me ask you here, Dr. Azzam, when we do something as such, how is it that a person is going to be feeling eventually after that? Let's say that I'm a marathon runner and I get this thing done. Would I feel the extra water weight? I mean, we get to see some of the people, some of the ladies particularly, when they're pregnant, that they complain about the water weight.
Yes.
So how is it going to be like?
We don't use water here. This is one of the advantages of this balloon compared to the other balloons, where we fill it with water. So the weight of this balloon is almost very, very light because we use nitrogen.
Oh,
so
okay.
it's actually nitrogen is lighter than air, so than oxygen. So it is very light. Patients will have the balloon and they can go directly back to their work. They can go directly and exercise as if there's nothing happened.
So the treatment,
it's like a day, like We come in now, we leave after an hour from the clinic.
The insertion takes about 5 minutes exactly.
So it's a very short treatment.
Yes, and so many patients, they are busy. They just come in, they have this capsule inserted, and then just go back to their work.
But is it removable?
It is removable. Now, normally we use 2 balloons.
Okay.
We insert 2 balloons. So we insert the one, for example, today, which has a size of 250 cc, and then we tell the patient to come back in 2 weeks and have the other pill. Because studies have shown that if you put 2 balloons, the weight loss is better. So we use normally 2 balloons. They both stay for 3 months, and then we remove them both.
Right. Now, Dr. Azzam, when we talk about these kind of balloons, and as we get to see here that this bottom capsule, I mean, I want to understand more of the technicality of it so that our viewers would be able to understand that this is a friendly procedure. So when you swallow it, that other part that you are holding from which the capsule is hanging, it is going to be sticking out from your mouth still.
It is. Yes, it is. So we're holding this side, and the patient will have the capsule, cup of water, and then drink it.
And then
while
this
swallowing the
part,
capsule, we're watching this. It has a valve that we can see through X-ray. So it moves down through the esophagus into the stomach. Once it's inside the stomach, we fill up this with nitrogen. The balloon will expand. And then finally, we fill it with water so the tube will detach.
Oh, so it would detach. Okay.
Yes.
All right.
And is there a specific diet that the patient should follow after?
Definitely.
Because I hope they don't feel like it's one of those procedures was like they enjoy their cravings and the special foods, and then they regret it.
You know what? There is nothing going to work without a diet. Surgery or balloon or any type of approach or intervention to treat obesity without having the motivation, without having the lifestyle modification on the patient side, there will be no good results. So every patient should be on diet. The patient will see dietitian before having the balloon inserted. They will have all the instructions, and then they just follow it. And this is how you lose weight, is basically you modify your unhealthy habits, whether it is type of food, the way of eating, or low exercise, beside a balloon or surgery, and then you lose weight.
So that procedure is only half of the success story. The procedure is not going to be the only way to lose weight.
Absolutely. I always tell my patients that, you know what, regardless of how invasive we use, whether it is surgery or balloon, this is only 50 or 60% of the treatment. The rest is actually on you. So you have to make changes in your life to get the results.
So now, Dr. Azzam, when we talk about any kind of medical procedures or even these kind of non-invasive procedures, as you're talking about the balloons, now we know that most of these things come with side effects too. For our viewers who would like to know more about this, tell us as to if this really has some side effects or not.
Nice. So the initial research, this is very new, the initial research that came up showed that the complication is extremely low from these balloons. The side effects or the symptoms that patients can get sometimes, just like any other balloons in the stomach. You know, you can get sometimes a feeling of fullness. You can get some discomfort in the stomach. You can get some nausea and vomiting, especially the next day. But it's only for a day or two with this balloon compared to a week for other types of balloon.
Right, but Dr. Azzam, as this is going to take its due space in the stomach, and you said that usually the next day the patient is asked, or the person, in fact, they're not really sick people, but you know, they're just looking for an easier modality in order to lose weight. So the second balloon is going to be inserted. Now, these balloons with their varied sizes are going to take a significant part of the stomach. That means that you would have a small part only, which is going to be left for you to ingest your food. Now, when we talk about such small servings of food that people are going to eat and start to feel full, would it eventually lead to malnutrition or certain kinds of physical weaknesses?
No, actually. Now, back again, we always put our patients on diet, on special diets, on a healthy diet, so they can always eat a very healthy food. Whether they have the balloon or they don't have the balloon, they have to be on that type of diet. Now, the space of the stomach that we occupy with these balloons is actually not that huge. I know most people think that we use the balloons to fill up the whole stomach. We don't actually. At the end, you have maybe 40% of the whole space inside the stomach that is filled with a balloon. So you still have enough space to eat.
For water, food, and air?
For everything you want to eat, you still have.
Okay.
But the advantage of these balloons, number one, is actually you get that feeling of satiety, early satiety. You don't feel hungry all the time. So this is the advantage, and this is how they work.
Okay. And pretty much, who should not consider doing the procedure? Because I believe just like in the medicine,
yes,
there's a procedure, but it's not meant for everyone.
Absolutely.
Who's the exclusion?
That's a very good question, actually. We don't use those balloons on patients who had a previous stomach surgery. It's actually contraindicated. People with on chronic medications that can affect your stomach wall from inside, we don't advise to, or we don't recommend having these type of balloons. These are the main contraindications that, generally speaking, prevent us from having balloons.
Indeed. And as you said, Dr. Azzam, that these balloons are eventually removable.
Yes.
So how long does it take before the balloon is actually removed, and how is it removed?
Okay. Well, those type of balloons stay for 3 months. Okay. So we have to remove them after 3 months. All right. And we remove them just like any other balloons by endoscopy. So we go inside, we deflate them, and we take them out. The removal is actually, it takes a short time.
And in 3 months' time, what happens? The person, after removing these balloons, is going to go back to his original appetite because he's going to have that 40% extra in his stomach, or what is it going to be?
Well, that's what we actually do when we put the balloons. We do a lot of education, we do a lot of counseling to prevent patients from going back. There's always that risk of patients going back to their unhealthy style or unhealthy diet that they had before. But with education and counseling that we have from dietitian, from psychotherapist, patients will learn how to eat well, what type of food they should avoid. But if they go back to their previous diet habits, they will gain that weight for sure.
Could smokers do this?
They can. We know that smoking can increase the acidity of your stomach. You have a higher risk for peptic ulcer disease when you're a smoker. The balloon can increase the risk of peptic ulcer. So when you put it in a smoker, they should know that the risk of peptic, it's not dangerous, but the risk of peptic ulcer disease is higher than normal people. We normally give some medications to suppress the acidity of the stomach for every patient, and it is for sure important for smokers.
And Dr. Azzam, what's the weight loss result is expected though after this procedure? Because I'm sure, like I mentioned earlier in the show, it's like weight loss is not something that's going to happen quickly within 1 or 2 months. Yeah. It's something that you should be, say, having a goal within 6 months and continue it for the rest of your life. Because there's no point of working hard in the beginning and at the end you just ignore it.
Yes.
What's the results?
Okay, so the initial studies that came up on this balloon showed that people can lose up to 40% of their excess or extra body weight. In numbers, or more specific numbers, the studies have shown that people can lose up to 10 kilograms in the 3 months period. Now you can repeat this treatment after having 3 months, initial 3 months, but we speak about 10 to 12 kilograms during the treatment time.
And when we talk about the body mass index, let's say that some of the people, they have perfect BMI, so I believe it's supposed to be 25?
No, so perfect BMI is between 18 to 24.9.
Okay, all right, so under 25. Now, for people who have perfect BMI, according to their height, their weight is just about fine.
Yes.
But nonetheless, let's say if it's a girl, she wants to look like that favorite supermodel of hers.
Yes.
So she's not satisfied with the weight that she has, even though it is suited for her height. Would it be helpful for those people as well, people who are not obese at all?
Yeah, no, the recommendation, we use those interventions, whether it is balloon or non-balloon, basically to treat people with overweight or class 1 obesity. So anybody who is above 27 BMI, then we recommend using balloons, OBALON or conventional balloon. But for people with normal BMI, if they want to lose more weight, then they can do it by exercise or diet. But we don't recommend using those for normal BMI.
Indeed, and Dr. Azzam, for the viewers at home, say they're struggling with obesity and they want to find a solution. Because I'm sure some of the patients that you've met, that they've tried to weight loss, it doesn't work for them for many months. They've tried to diet, it doesn't seem to work. And this seems they're desperate for a solution. How can they learn more about this procedure? To whom can they go to? And how expensive is this procedure?
Well, there are so many resources now in the internet. There are websites for the OBALON itself. It's obalon.com. There is a website that is related to Dr. Sulaiman Habib Hospital. They have YouTube, you have videos that explains everything about this balloon, everything that the patient will need. And then we are actually in our clinics to educate people. So we spend more than half of the time with the patient just to explain and educate them about these, how do they work, the complications, whether it is a good option for them or not.
Indeed. And Dr. Azzam, we get to see that people even who are sincerely trying to lose weight and trying to resort to different diets and exercises, they all have, you know, cheat days on the diet as well.
Yeah.
What if somebody, after having the balloon inserted, are still going to be cheating on the diet or the regime that they're supposed to follow?
Yeah, well, they're not going to see the good results that they hope or expect to. So the balloon will never prevent you from eating, for example, high-calorie pizza or full-fat pizza or a big burger. These are just to help you to control your diet. If you eat junk food, or fast food, or high-calorie food while you have the balloons, you might not lose the weight that you are hoping for. So that's that.
And Dr. Azzam, one last question. What advice would you like to give for the viewers at home, especially for the ones that they start to see that the obesity has become a huge issue for them, whether smoking, their lifestyle? What advice would you like to give the viewers at home?
Well, I think everybody who is faced with or have an issue with weight should seek an advice from experts, whether a dietitian or a physician or a surgeon. They should do a lot of learning and changing their habits, whether the unhealthy diet habit. They should do daily exercise. The minimum that we recommend is half an hour per day for 5 days a week. That's a minimum exercise. They have really to work hard on changing their lifestyle and eating habits.
Indeed. And with this, Dr. Azzam, any of the questions that we would get from our viewers, we're going to be forwarding those to you for sure. And at the same time, I would like to thank you so much for joining us in today's edition of
Thank you for having me in the studio. Thank you.
And we wish everybody all the very, very best in pursuit of happiness and to be living a better life. You should seriously be considering weight loss if you are getting anywhere close to obesity and if your BMI readings are not suited for you. Joining us here in the program was Dr. Azzam Al-Qadi, who is a consultant bariatric surgeon. If you have any questions, feel free to send those to us and we would be able to connect you with Dr. Azzam. So, well, keep sending us your questions, and for the moment, we are going to be embarking on towards our next report. We'll be joining you after that. Stay tuned.
Let's start by telling you a few things to prepare you for your surgery.